Thank you. Welcome and good morning, everybody. Thank you so much for joining us. My name is Maureen Brack. I am the Talent and Education Director. I work with the Greater Binghamton Education Outreach Program, or GBEP. It's an affiliate organization of the Greater Binghamton Chamber of Commerce. And I'm excited because I get the pleasure of being able to moderate today's panel. Our Spark panel today is going to highlight the field of dentistry. Spark is a collaboration between the Chamber, BOCES, SUNY Broome, the Broome Tioga Workforce, and the Broome Life is Good campaign. And so you guys are going to learn more about what are the different careers and pathways that you can explore in our community. And as I mentioned, today we're going to be highlighting dentistry. Just some quick housekeeping. Today's is going to be recorded. And so if at any point our students have to hop off early, or maybe you missed one of our earlier recordings, we encourage you to go to Spark, greaterbinghamton.com. You'll be able to view the recordings there. Our past sessions, we were able to highlight nursing, entrepreneurs, and construction and trades. And for our students, today is all about you. So use this time to be able to connect with these wonderful professionals who are volunteering their time to help you. Ask them questions, learn more about the field and the pathway. You have a Q&A function in Zoom, and so we encourage you to use that. And while I have the pleasure of moderating today, I mentioned Spark is really a collaboration, and two of the colleagues I work very closely with are Matt Sheehan, our CTE principal with BOCES, and Gina Chase, the interim director of career and academic services at SUNY Broome. This wouldn't be possible without them, and they are going to be managing that Q&A today. So let's make it really busy for them and ask lots of questions. I also want to give a thanks to our sponsor, IBM, for whom today wouldn't be possible without. So before we dive into our panel, let's talk a little bit about the dentistry occupation. What's the outlook look like? Our folks at the agency were able to compile some data for us. And so regionally, when we look at the 4-county region, which consists of Broome, Shenango, Delaware, and Tioga County, the average salary for a dental assistant is about $35,600 a year. For a dental hygienist, it is $62,600 a year. That's actually one of the highest paid allied health professions. And for a general dentist, you're looking around $174,000 a year. When we look at our area on average, we've got an annual need for about 29 dental assistants every year. We need about 10 new dental hygienists every year and 3 dentists. And that's to fill in those vacancies. So thinking about folks who retire, maybe are leaving the area. And so we're always looking for new and upcoming dental professionals. And so that's what today is about, helping you guys learn more and seeing if these could be a good fit for you. I'm excited because we have a really dynamic panel today. I'm going to let everyone introduce themselves. And so first up, I see I've got Dr. Scannell. Do you want to introduce yourself to everyone? You're on mute.
There we go. All right, technically challenged, sorry. I'm Dr. Patrick Scannell. I've been an orthodontist for just 3 years now, practicing in Johnson City. And I went to Vestal High School, so local kid, and went through state schools my whole path. So I can touch more on that, but welcome everyone, and I look forward to talking with you.
Thank you. And we have Dr. Jim DeSantis.
Hi guys, I'm Jim DeSantis. I am an oral maxillofacial surgeon. I actually grew up here as well. I went to Owego to high school and went to Broome for a year. And then after Broome, I went to Cornell. And then my path was pretty long. I went to University of Buffalo to dental school. And then I went to University of Buffalo to medical school. And then I did general surgery there and then oral maxillofacial surgery there. So it was a bit of a long haul, but it's worth it. I love what I do. So good stuff. And these guys are all very, very nice people that you're talking to today because I know all of them. So thank you.
Thank you. And we have Dr. Mustafa with us.
Hi, can you hear me?
Yes.
I'm Dr. Mustafa. I'm the owner of Orthodontist Southern Tier. I got my orthodontic residency in Jacksonville, Florida, in 2012. And prior to that, I had a doctorate in the science of dentistry, which is like a PhD, but a step above, studying the physical properties of thermoplastic that are used in aligners like Invisalign. And prior to that, I did advanced education in general dentistry in Marquette University in Milwaukee, where I was originally born. Right now I'm available to show you, to show the students basically what I do when they like. And
Awesome, thank you.
mhm.
And we also have with us Jamie Matt.
Yeah, hello there, guys. I'm seeing Dr. Mustafa's stuff first. But anyway, name's Jamie Matz. I'm a dental hygienist, graduated from Broome back in 1991. Then this year it'll be 30 years practicing. I went to Harpersville School and then I stayed at home and then went to college, and I was the second male to graduate as a hygienist from BCC back in the day, but since then there's been many more. I went into it not knowing what I wanted to do, and 30 years later I'm still at it, and I love my job. I mean, helping I work in a pediatric office over here at Dinosaur Dental. Been here since we opened 6 years ago. It's a great field. Feel free to ask me anything.
Awesome. And speaking of SUNY Broome, we actually have some folks over at the SUNY Broome Clinic with us. We have Jennifer as well as Dr. Rufo. And I know you guys are just getting set up, but if you have the option to turn your mute off and be able to just introduce yourselves, we'd love to introduce you to our students. Having some sound issues. All right, we'll let you guys work that out, and when you're all set, just let us know. Let's dive right. Oh, I can hear you now.
If you need to go back to your students.
No, because I already passed them off. I was just checking the one.
So you're good?
I'm good for right now.
Okay.
Yeah, Jennifer, we can hear you guys. So if you don't mind introducing yourself, that would be great. Maybe still getting set up because we can't see you.
Yeah, with the mask. Dr. Mustafa.
All right, we'll let you guys get set up. Oh, there you go. Jennifer, we can hear and see you guys just fine. Can you hear us?
I can barely.
All right. We were going to say, do you want to introduce yourselves or do you want a minute to get set up?
Can you guys hear me okay?
Yeah.
Okay, so I'm Jennifer Novobilski. I am one of the clinical instructors here at the SUNY Broome Dental Hygiene Clinic. Sorry for the late start. It's actually a crazy day here in clinic. We have 21 students with 21 patients. So I've been kind of running around. It's a typical clinic day for us here.
And then you've also got Dr. Rufo with you as well too, correct?
I'm sorry, I can hear you now. What did you just ask?
You've got Dr. Rufo with
Yes,
you as
Dr.
well too.
Rufo is here. He is our clinic dentist who's on the floor with us today too. So we've both been running around since 7:45 this morning.
Well, that's perfect. That's what we want to be able to show folks today is what the field of dentistry looks like. And I know a lot of folks are kind of here in between patients. And so I want to kind of dive right in and let students start asking some questions. And I know Dr. Scannell can't stay with us long, so I'm actually going to pose you a question first. So thinking of our guests today, 8th grade students, what's some advice that you would give them in terms of this field? You know, what's your favorite aspect of your job, maybe your least favorites, and what pathway would you recommend them investigating?
That's a great question. Thank you. I think, the best thing about dentistry, whether you're, dentist, dental assistant, hygienist, front desk, any part of it is your constant interaction with patients and your team that you deal with every day. So going into dentistry, I knew what I wanted was to work around people, kind of help improve or make things better for them and have that constant, interaction, positive energy, and being able to see your work hands-on, what you're doing. So if you like any of that stuff, it's a great field. Putting myself in your shoes in 8th grade, I had no clue that dentistry was my outlet for that. But the key was just keeping my options open. So, working hard in school and exploring the sciences, math, even some history stuff, and having a scope of things, and then getting in some different offices to see what it's like, to kind of guide, if it was the path for me. But the more you see and the more options you consider, the better you'll be able to find that path for you, whether it's the dental field or any area that kind of piques your interest in that way. So that's kind of how it worked out for me.
Maureen, you're on mute. Maureen, you're on mute.
Thank you, Matt. My next question I wanted to throw out to Jennifer or even Jamie, kind of, becoming a dental hygienist, what does that path look like? How long were you guys in school for?
You want me to take this one, Jamie, or?
Go for it. It's not
Okay. So dental hygiene is a 2-year program. It is a lot of science intensive. So you also have to have anatomy and physiology, microbiology, and the microbiology lab that goes along with it. But it's a tough 2-year program. We squeeze a lot into just 4 semesters here at Broome. But once you get out and you finish your 2-year program, there's 3 board exams that you take. And then hopefully from there, you can go out and find a job. The nice thing about the dental hygiene field is it's not just limited to clinical practice. So I work in a private practice, but I also am able to come here and be an instructor. There's so many other fields that, you can go into pharmaceuticals, you can go into a dental rep, you can continue your education. So it doesn't just have to stop at the 2-year associate's degree. So I myself have a bachelor's of science in biochemistry, and that allows me to be one of the clinical instructors here on the floor, and just kind of help to pass my knowledge on to the students that we have here.
Awesome, thank you. And speaking of some of the different fields, I know that Jamie is really passionate about working with pediatric dentistry. Can you kind of tell folks what it's like being the dental hygienist and working with pediatrics on your day-to-day?
Definitely. As I told you the other day, a day doesn't go by. And back in the I worked at a general practice for 22 years, and your patients became friends. Or every day you're looking forward to seeing somebody. And now the past 6 years with Dino, to have a 3-year-old or a 4-year-old come into the office, happy to be here, come running across the floor to either jump up in your arm or grab your leg, or they're here to see Mr. Jamie to get their teeth cleaned. Nothing beats working with the kids, because it's like, if we start being that I worked in the general office, you'd have people come in that had bad experiences as kids at the dentist office, and they didn't like per se coming, but they knew they had to. Working here, I feel we're setting up a foundation for these kids that they see me they start at 6 months. I see them every 6 months till they're 19. They leave here, they've never had a bad experience. And I'm setting that foundation that hopefully when they're, 40, 50, 60, they're still going to the dentist every 6 months, enjoying it because they had the foundation that was built here. And like I said, dealing with the kids, they're brutally honest. They don't have to tell you that you're good at your job. And to have every day, there is at least, one child, hopefully more, that, is very happy to be here. And like I said, to see Mr. Jamie to get her teeth cleaned, and roughly see anywhere from 16 to 18 kids a day. I work 4 days a week. The hygiene has made it so, I've stayed in Harpersville. I've lived at the same place since I was 12. And it's provided a very, nice life for me. Have don't have a mortgage. I have a nice truck. I have, I've raised my daughter. It's just, like I said, the hygiene, I would have never thought 30 years ago that hygiene would have done what it's done for me. And I love the job, and the kids are the icing on the cake.
Thank you, Jamie. And so hearing Jamie's kind of schedule, looks like there's, the typical 4 days a week. I'd like to hear maybe from Jim. Do you want to tell us a little bit about what your schedule and kind of your weeks typically look like for our students?
So my schedule, my gig is a little bit different because I have a lot of hospital call that I have to cover. So it's a little unpredictable from that standpoint. My work week, I usually start Monday morning at about 8. Then I work seeing patients until about 5, and then probably about an hour of paperwork. So it's, I always thought it was going to get less busy, but it doesn't. And then a lot of times, my deal is a little bit different in that I kind of like everybody else here. I kind of always knew I wanted to do something with dentistry or something with medicine or something. And I wasn't exactly 100% sure. And I kind of thought about orthopedics and kind of thought about plastic surgery, and oral surgery and dentistry kind of was great because I can do a little of all that kind of stuff. And I fix broken jaws and broken noses and a lot of that kind of stuff. And so a lot of that, fortunately or unfortunately, happens after hours. So it doesn't really come out of my regular work day, but people get hurt in the middle of the night when they're not being smart sometimes. And we see a lot of bar fights and car accidents. And, if the citizenry behaved a little better, I'd probably get more sleep. But, so generally I work 5 days a week, and then probably at least once on the weekend, maybe twice I'm in the hospital doing something, and probably a couple nights a week. So it's a pretty busy gig, but I love it. And, I've got 5 kids, and my wife happens to be a physician. So we kind of juggle the whole thing all together, and she's busy a lot too. So it just kind of works. And, but I love my job, and there's not a lot of downtime, but there's a lot of fun time. And, that's it. So there you go. I think you're still on mute, Maureen.
I'm usually so good at unmuting. Thank you. I wanted to ask Dr. Mustafa, I think something that's really exciting for students might be the equipment that you guys work with. It's such a hands-on field. And so I kind of wanted to ask you a little bit more about the day-to-day and some of the things that you work with in the clinic setting.
Sure. So right now I was working on an Invisalign case, basically designing the attachments that I would need for the aligners to engage the teeth so I can move them in a favorable way, predictably. So I'll just switch the screen so you can see my screen right here. So all I'm doing is really like, okay, maybe I could make that one bit, a little bit bigger so I can have, a bigger attachment means better engagement, and I can move it a little bit. And basically I go here and I see, okay, that's why I have that one like that. And then I add another attachment, and basically I'm looking for undercuts so that I hope I'm not sharing too many secrets. But essentially that's how you move teeth with aligners. You look at I go back and forth, and I keep playing, and and then going over the movements that I need. So for this patient that I was showing you, I'm going to walk through. So basically he had some older attachments, and I was placing newer attachments to refine the movements. It starts with a scan. So we have a scanner right here that you can scan inside the mouth instead of taking the traditional impressions where it's gooey and gaggy and yucky and messy and all that. And after that scan is taken, then I can work on the case, whether it's a new case to start or a refinement like what I was doing earlier. And then for traditional braces, we also scan, and I basically place the brackets digitally. So, I'll give you some insight on that too in a second here.
We're getting a little impromptu tour. I love it. Thank you.
Oh, yeah. Well, I have the time before they call me. I'm in between patients, so I'm gonna try to do that as efficiently as I can. So here, let me see. 1 second. So basically, I like the idea of having digital orthodontics. So it's not just with aligners where I can do a digital treatment plan and do everything ahead of time. So it's obviously far more convenient than, having to work my way with braces, but also with braces, I would have here, basically I place the brackets, 1 second. So I have the brackets placed, digitally. So I will here display that and basically try to take off the.
Almost like a video game for students to think about that.
It
They don't
is.
just throw the brackets on there. There's a lot of planning.
Yes, you don't sprinkle them like salt, like So basically, this is how the teeth are right now in the upper arch when it's not straight and I had the brackets. The way I put the brackets would be, for instance, I would basically toggle right here. So this is when it should be straight. So going back and forth, not straight, then that's how that would look like based on how I place the brackets. And then I'm gonna go back to the original and it showed the trays. So basically those trays are 3D printed, just like the models for the aligners. With the aligners, they suck down the thermoplastic on the 3D models, and that's how you get some striations or lines in the aligners that you may notice. With those braces, basically, we will have the jig 3D printed sent to us, and then my staff can simply just put the brackets and place them to the ideal position that I wanted so I can get that ideal alignment that I wanted. And obviously, I would have to make some artistic bends with the wires when I see the patient with braces. So, I'm always needed. It's not just me and the computer. And right now, I'm going to try to switch to the clinic area. So I will I'll probably show you. Do we have a jig here? No? Where? Can I see it?
I can't, you're gonna have to.
Can I have a jig? A jig. Yeah. So obviously those are some patients' boxes of their aligners. And then this is how the jig looks like. So in the bag right here, sorry. I wish I did a better job with the camera. But
No, you're doing great. Thank you.
Yeah. So that sums it up. You mentioned something about sterilization and obviously before COVID we moved to that office and we've had the latest and the greatest in sterilization and disinfecting equipment and solutions. And then I have to, when I'm seeing patients, not only wear that mask, but I also have to put on a face shield. So it's kind of like those sci-fi movies. And it goes, even though we're all immunized by now, but I mean, we've all had our vaccination, but still we have to take the, go the extra step to stay safe, especially with the new strains.
Absolutely. And that was a big question we had at our last panel. Students wanted to know about the ways that COVID impacted the work that everyone's doing. Jamie, I know you shared with me, you guys working with young patients had some really unique things that you put into practice. Do you want to share that with our students?
Sure. Yep. Being that we have to wear masks now more or less 24/7 here, they went and they had these little buttons that more or less show the kids, this is what I look like with their, underneath all this stuff. And like Dr. Mustafa, we're wearing shields. We have our N95 masks and then a mask that we go put over. But honestly, patients would come in and I would tell them, Maureen Henkin, my instructor back in 1991, she set up that whole clinic over there. They set us up. You treat everyone when they come in as if they're carrying something, and so we're disinfecting, sterilizing, everything. So when this all came about, I was not worried or scared to be in this field. Because it's like from day one, we were taught this is how you treat everyone. And they set us up for success 20 years ago. And I mean, like I said, it'll be 30 years. I've never called in sick in 30 years. And I honestly, I mean, it's the way we were taught, washing your hands, you know, wearing your PPE, you know, gloves, all that stuff, you know, it's just like comes naturally anymore. But a lot of things, like I said, and one nice thing with the kids, one thing before when they would come in, some little ones first time they come in, see people with masks and they get scared. Well, now everybody and their brother was wearing masks out in public. And so when they come in here, it's no big deal to them and we aren't scaring anybody. So you find it hard, you know, when you go to tell some, you know, when a child to open wide and you're going, and they can't see your mouth. That's a little tricky, but no, here, like I said, really we've always been doing our, you know, sterilization procedures. We have really good sterilization assistants. You know, we're part of Dinosaur Dental is part of Layler Family Dental, and you know, we go to, you know, whatever it takes to keep everybody safe. And like Dr. Mustafa said, us being vaccinated, and but just going back to treating everybody as if that they're a carrier for anything, a common cold, you know, anything. And so you want them safe and you want yourself safe. And but no, it's like I said, hygiene's been a great field. And I went, you know, and again, you know, it's like I could still be doing this 20 years from now, you know, and you know, 50 years in a profession. You know, especially with the kids. I mean, I have no problems with my wrists. You know, in the adult practices, you get into a little heavier debridement and cleanings, where the kids, it's, you know, really talking about getting them on the right course for, you know, better dental health and making it a fun appointment. And I say Dinosaur Dental is like the Disney World of dentistry, because they all come in and parents will be like, kids are talking about they couldn't wait to come to the dentist, and you don't know what a feeling that is. So.
That's awesome. Thank you. And Jim, I would hear you mentioning, you know, you're always on call. And so I want to hear, what were some of the exciting things maybe recently that you've had in terms of patients that students may be able to expect if they kind of go into this field?
Well, it's, you know, I have a buddy, which I'll use this as an example. I have a buddy who happens to be one of my college roommates, is an FBI agent. And I said to him, is your job as cool as I think your job is? And he said 80%, or he said 20% of the time, it's cooler than you think it is. I mean, the toys that this guy's got, it's unbelievable. He comes home from Texas and he's just unbelievable. And he was a guy who was on TV on one of these FBI real stories of the FBI and all stuff. I said, is your job as cool as I think it is? And he said, 20% of the time, it's cooler than you think it is. 80% of the time is boring. So that's kind of the same kind of deal with me. It's never boring, but it's not all bloody and glamour and all this kind of stuff. There's a lot of paperwork, a lot of work, all that kind of stuff. But from a day-to-day standpoint, I take out a lot of wisdom teeth. I put in some implants. We do some pathology and tumors and that kind of stuff, which is all pretty rewarding stuff. And unfortunately, it seems even lately that we've had a lot of, you know, cancer cases that people have come in with tongue cancer or cheek cancer, this kind of thing. So it's been, you know, it's kind of humbling, and several of these people lately have been young. So that's unfortunate. As far as the stuff the kids would probably think is kind of cool, I mean, unfortunately or fortunately or whichever, thankfully everybody has done just fine. But I had, you know, some of the ones that stick out. I had a gentleman who was cutting down a tree with a chainsaw, and he was cutting down the tree like this, and it hit something in the tree, a knot or something, and just cut him kind of to pieces in the front. And this guy was a walkie-talkie, like fine, bleeding all over the place, blood. I mean, he was just a mess. And I walked in the room and I said, hey, how you doing? My name's Jim DeSantis. I'm one of the surgeons. And he goes, well, Jim, I went and did it this time. I mean, this guy was, you know, cut in half, and he's talking to me this way. So there's stuff like that, which the kids probably, would find somewhat interesting. But we see a lot of, kids who have sports injuries. I see a ton, believe it or not, of field hockey injuries. Tons of kids lose teeth playing field hockey, break their jaw playing field hockey. Or I had one girl who broke her nose 3 times in one season playing field hockey. It was, I don't know what she
Hold
was.
the phone while I'm working. You could watch.
We see a fair amount of car accidents, unfortunately. And interesting because with airbags and the kids now, everybody's had airbags. When we were
They're
all,
on
there
the
were
phone
no
back on.
airbags, so it was, you see a whole different host of injuries with airbag injuries than you do with other stuff. So thankfully, a lot more people are surviving, but a lot more people are having trauma to their face. So I do a lot of that kind of stuff. And again, a lot of sports injuries. So it's, it's an interesting kind of deal. But unfortunately, we have some people who get very, very sick and have infections and succumb to their disease, that kind of thing. So it's been busy. And with COVID, and I won't hog up all the time here, but with COVID, my practice in the office with dentistry, so the kids know, and all these guys could tell you and gals, that the governor actually closed down all elective dentistry for a period of about 2 months, maybe a little more. So they allowed only emergency care or urgent care. So nature of my practice, I see a lot of that kind of stuff. So I stayed pretty busy throughout that time, and I had a lot of trauma stuff and that kind of thing. But a lot of dentistry sort of shut down significantly. So people became very busy afterwards. They didn't have much going on before, but it was very busy after everything opened up. And a lot of people, unfortunately, a lot of stuff that were a bad problem in March of 2020 became a horrendous problem by September of 2020. So it became a little bit different kind of entity for, for the folks with, for the dentists and the dental hygienists and the staff. Thankfully, we were able to stay, more or less open, but mildly open. So from a paying the bill standpoint, it wasn't great, but from a staying busy standpoint, it was fine. I had one case, and then I guess I'll let you go with that. But I had one case that the guy had a car accident. He happened to have been an FBI agent, oddly enough, and had a car accident up near Windsor or something, or Deposit. He had a summer home. He was from Manhattan, came up here and got in a car accident on the way home. They had to take his dog out of the car. He had a service dog, and he was knocked out and everything, and take his weapon and all this kind of stuff. So he was an FBI guy, federal agent at any rate. And then he ended up breaking his jaw. So we had to operate on this guy. And back at the time, they didn't know if he had COVID, didn't have COVID, and they didn't have the rapid tests available at this point. So I operated on this guy with what looked like this NASA, astronaut suit. I mean, it was a helmet with a suction thing inside the helmet and a hose off the back. It was a negative pressure room and all this kind of stuff. And I'll be honest with you, that was the first case I had done like that. It felt like something out of a movie. I said, all right, this sucks. We got to get over this. This is no good. You can't see, you can't. But, thankfully, with the advent of people understanding the disease a little bit more, and vaccinations and herd immunity and just general common sense, I think we're kind of hopefully getting over the hump with that stuff. So I will say one thing, that Sam Rufo is in the middle of my screen, who is a guy who I consider kind of a mentor. He's a great guy, and he'd be too humble, but for the kids that might want to know, he not only is a dentist who had his own practice for 30 years and now works at BCC, but he was also a colonel in the Army. So he, if there's kids that have all these kind of questions. So Sam is the kind of guy who you run into him in a grocery store and you wouldn't know that he did anything, but he's a pretty impressive dude. So at any rate, Dr. Rufo, good to see you. So there you go. I figured I would embarrass him a little bit.
Well, that's perfect. So I wanted to turn it over to Dr. Rufo next to kind of hear, with dentistry, having previously had your own practice, what are some of the things that for high school or middle school students you think they should know about what that experience was like?
Okay. Well, I graduated dental school in 1975, and I retired about 5 years ago after 42 years chairside. It was a terrific career. My advice, okay, if they are interested in dentistry, as they get closer to selecting, undergraduate school colleges, they talk to their dentist and say, can I spend a day or so in the office just observing what you do, just to get a good feel for, what the real world is going to be like. because it is, it is, from my recollection, it's still a long road to get a degree in dentistry. It's 4 years of college, okay, with emphasis on the sciences, and then 4 years of dental school. Now, when I graduated dental school, we took a licensing exam, both clinical and written test, to get licensed. Now I understand it is a 1-year hospital-based residency to get licensure. So that's a 9-year program. But I enjoyed general practice entirely. It was great. We met a lot of nice people, a lot of my friends. They became family, basically. But I also want to say that as a general practitioner, okay, I thank my lucky stars for the specialists of the world, Jim, okay, Dr. Mustafa, the pediatricians, because there are certain times, okay, when you get patients that look like, this is very difficult. I don't do many of these, okay? You want to give them the best service possible, and we've got these specialists, and these guys are great, okay? I also paralleled my career, okay, with the Army, okay? I was a member of the Army Reserve, thanks to my dad, with a World War II vet, said, why don't you get in? I did, okay, it was worth it, okay? Through the Army, they would send, okay, dentists to many different Army hospitals throughout the country. Started sending, my last 10, 15 years to third world countries where we set up field hospitals, where we brought, physicians and dentists and did our services out the field. Ending of my career was around 2002. Okay, got activated to go over to Iraq because the war had started, which hopefully we'll be finishing soon. But it was an experience of a lifetime. I worked with an oral surgeon there, and I can really appreciate what the Dr. DeSantis's of this world do, okay? Because I did a lot of procedures, okay, that they never taught me in dental school, and I would probably never, okay, do in private practice. But that was my career.
Thank you so much.
Mhm.
What great, interesting things for students to be able to kind of think about when they go into those careers, and the ways that there's different pathways to get there and different experiences complement it.
Yeah.
That's great. We had another question come through. Let's see here. What about, does anyone want to talk about the client relationship? When you have your patients, what's one of the things that's really important about that relationship and something you think students should know?
I guess I'll take that one. I think to be a good hygienist, you have to be, people describe me, I'm a little over the top. I'm very enthusiastic. I love what I do. I love people. Making that initial connection. So like I said, I'm here in the clinic a couple days a week. I'm in private practice a couple days a week. And you start to see the same patients over and over again. And I'll have people ask me, well, how do you know this person? They must be related to you. And I don't know them. I know them because I've been in the clinic for 7 years now. They come, every 3 to 6 months, that you start to build that relationship, and you know about their family, you know what their interests are. And that's what patients like to see. They like to make that connection with somebody. And once they have that, then they might not be as, hesitant to be coming into the office. They actually look forward to coming in and seeing, a familiar smiling face. Unfortunately, with all the masks, you see just your smiling eyes right now. That's my joke, but you really have to be more social. And like I said, just be more patient oriented and really like to engage with people. Here in the clinic, like I said, right now there's 21 different patients that are here. Everybody has their own backstory. So you just try to you make a small connection with somebody just to get them excited about, hopefully coming back to us.
Thank you. And I think we've got time for maybe one more question before we ask you all for some final words of wisdom. And so the last question I want to know is, knowing that some of you may oversee some of your office functions, kind of from the manager perspective within the dentistry field, what are some of the things that go into that piece of it?
I'll speak up here a little bit as far as at Dino. I'm a co-manager here, and just keeping the team. I mean, we have grown in the past 6 years. We now have 8 pediatric doctors. There's 11 full-time hygienists. about 30 assistants, a business team. And as you're hiring people, making them, keeping this team aspect as far as we work at the end of the day, everybody's asking, does anybody need anything before I leave? And it makes me smile on the inside to hear that we wear these radios, I'm tuned in every day, but it's like, we all care about each other before we're leaving. And one of my big things is, the past 6 years coming to work here, I've never not looked, yes, would I like, a day off, wake up in the morning in the sunshine and it's like, ooh, I'd like to stay home. But I never dread coming to work. This team here that we have is, I spend more time with them than I do my family. And they're my work family. And, if I get a call in the middle of the night from anybody, or, it's hiring people, keeping the team, as one, and just, looking forward to seeing and working with these people every day. And like Jennifer said, as far as you're smiling with your eyes, you're exactly right. I mean, there's so much you can do with the tone of your voice. And as far as a hygienist, it's like caring. Part of me wanted to be a veterinarian. Well, I couldn't go away I got accepted to both veterinary school and hygiene. But if I left, I got a pony when I was 8, and it's like, if I left, nobody could take care of the pony. So I stayed home and went to Broome for hygiene. So I always say the animals chose my profession, but I feel like a dental professional has to be that caring sort of person. And when I'm interviewing people and they say they have dogs or it's like, okay, you're gonna fit. That's one of the, like, caring about an individual, caring about an animal. It's a very, caring field, and then caring about each other as your work family. So.
Thank you. And I think Dr. sounds like you wanted to go off mute too. Did you want to add anything about kind of the management side of the office?
I'm sorry, did you direct that towards me?
I thought maybe before, it looked like you were about to go
Okay.
off mute.
Yeah.
I know it's
No.
tough when there's multiple people. Is there anything you wanted to add about the management side?
Yeah, absolutely. So dentistry is sciences, a little bit of art. It's very, one box of the actual work you do. The business side of it is a completely different thing altogether. So just because you go into dentistry doesn't mean you have to have your own office. There's hospital settings, there's big group practices, but a lot of times it is, by yourself. And that's how me, Dr. DeSantis, Dr. Mustafa, and Dr. Rufo, to an extent, we're all set up. And so you wear a lot of different hats that you kind of have to learn on the fly. So you have to work like Jamie with a team of people and finding the right fits for your office, but also dealing with the legal side of things, the business side of things, HIPAA and OSHA, the governing bodies, and just running a business completely. So it's a lot of different hats to wear. And you have to spend as much time on each of those as you do with your patients too. So you have all those different relationships that are important. So I guess that's all I would add to the equation there is it's more demanding, but it's also more rewarding too, that you get to do all those different roles.
Thank you. And so kind of thinking, I know our time's coming close to an end here. I'd like to give everyone maybe 1 to 2 minutes, kind of telling students, what is the advice that you want to share? We've got 8th grade students with us today. Hopefully you have sparked their interest. You've toured your offices, talked about, what it is you do in your day to day and what makes everything so exciting. You're also passionate. For these folks, what can they do in 8th grade? What are some of the academic preparedness for some of your pathways? Maybe some of the different opportunities that you would recommend they explore. And I'm just going to kind of go through in order that I see folks. So I see first, Jim, do you want to tell folks what your advice would be?
Sure. I have a freshman in high school. I've got kids that are from 21 down to an 8-year-old. So one of my guys is a freshman in high school. So he's pretty close in age to you guys. And, the best advice I would give you is that you don't have to be Albert Einstein to become a doctor or a dentist. You can't be a knucklehead, but at 8th grade, you guys have some decisions to make. And I don't care if you want to be a doctor, you want to be a cop, you want to be a teacher, you want to be a garbage man. As long as you do what you love and you're good at, doesn't matter what you do. Do something that you're going to enjoy every day for 30 years, because that's where it goes. The next bit of advice, or my thought would be that at 8th grade, if you've been kind of a knucklehead for a while and you didn't do your homework and all this kind of stuff, you get to start over again in about 4 months. So when you're a freshman, things really start to count. So you have to really pay attention. You have to try and do your best. You want to play soccer, play football, play baseball, be in the band, be in the, be a cheerleader, be on the drama squad. Anything that you do, every one of these colleges is going to want to look and say, all right, is this a well-rounded kid? Is this a kid who studied hard, did some other things, was in the church group, worked at the food bank, do a lot of that kind of stuff. I see, I get a lot of kids who ask for a letter of recommendation, all that kind of stuff. It's very easy when you know these kids and they're just good kids. So you want to be a good kid, you want to be a smart kid, or at least a hardworking kid, and do all that kind of stuff. As Sam and some of these other guys have said, concentrate on the sciences, but don't only be on the sciences. You need to do a little of everything. But again, if you've been thinking, well, it's too late, I got a D in math last semester, you get to start over in September. And some of the guys, Matt was a teacher for a long time. He's met my kids. He can tell you, if you know that you're going to work hard and you're going to be a conscientious student and person, you still have a lot of time to make this work if you want to make this work. So work hard, have fun. You don't have to go to Harvard, as Patrick had said. I went to Broome for a year, loved it. One of my best college years ever was at Broome. So there's absolutely no issues there. I went to Broome for a year, and from Broome I went to Cornell. So, I loved it. As long as you work hard and you do what you want to do and you're happy, it doesn't matter what you do, but do it well. That's my only bit of advice.
I love that. Thank you. Next, I'm going to go over to Dr. Patrick Snow.
Yeah, I don't think I could say it any better than Dr. DeSantis did right there. So just echoing it completely. I mean, keep your options open and do what you're passionate about. So that's, what I was, church groups, sports clubs, be involved, be a leader and kind of pursue what you like and explore it in every way you can. He's right. Going into high school next year, it's a big step up, but a big opportunity too. So just approach it with passion and commitment and try to find, your area that you love and pursue that even more. And that's worked for all of us to this point too. So it's great. Thank you, Maureen.
And I'll turn it over, Jennifer and Dr. Rufo. I feel like Jim did a great intro to Broome. So if students want to get into the program, what are some of the courses they need and what's some of the recommendation you guys have?
So like I had mentioned before, our 2-year dental hygiene associate's degree also includes anatomy and physiology, microbiology in a lab. And you also need to have your English electives, psychology electives. You can come right out of high school though, and you can take those concurrently with the hygiene program. So it can be, a 2-year program. You would just be taking those classes in addition to the hygiene classroom work and the clinic work. Here, our program, you see patients for 3 out of your 4 semesters. So I think a good thing is if you think this is something you want to do, right now is not the best time with COVID, but going and shadowing, in a private practice office or, going to see whoever your dentist is, and just kind of seeing the day-to-day, what does it entail? Like, is this something that you think that you want to do? Like Jamie said, for the next 30 to 40 years. The one thing I like about hygiene is you will never have the same day twice. So everything that I'm doing this morning with the seniors in clinic, I have a lunch break and I come back and I'm with the freshman students. It is not going to be the same thing. They're at different levels in their learning right now. There's going to be totally different patients here. And then tomorrow I will go to my private practice office and I will see 10 patients there. And again, it's not going to be how anything that I did today. So keeping your options open and being open to, having those days where you just don't know what to expect. You can see names on the schedule, but you don't know, the type of mood someone's going to be in, and you can totally change, someone's, whole mood just by, again, smiling with your eyes there. But yeah, our program here is wonderful. Like I said, it can be done in 2 years. And if, you come in, you could have a possible degree before that, and it could knock off some of those gen eds that you would have to do. But I think hygiene is a wonderful profession. And like I said, I'm able to do both, be in the classroom here and be in a private practice setting as well.
Thank you. Anything you want to add, Dr. Rufo?
If I had my eyes closed, I would have thought Dr. Jim was my father talking to me. Right on the head. Pick a career that you think you're interested in, okay, and be very passionate about it. At this younger age, 8th grade, my recommendations would be get involved in your church, get involved in your community, be a volunteer, be a well-rounded individual, because with that in mind, okay, when you get to dental school and come out, you'll be very successful.
Thank you. And Dr. Mustafa, thank you for the tour. We even got to kind of see you working right there with a patient. That was so exciting. So if someone now is like, I want to be an orthodontist, that looks so fun, what should they do? You're on mute, by the way.
It is a long journey. I would say, obviously, like Dr. DeSantis and Jim and Jim and Pat and everybody was saying, and Dr. Rufo, you have to love what you do so you don't have to work another day in your life, basically. And both of my parents are orthodontists, so I was working when I was at their age in their offices. So I was assisting and I was basically working in the lab. So that primed me to be able to have a good idea about what I am good at and what I wanted to do. So I went through that journey, and after dental school, I had to do a residency in general dentistry and then a doctorate, so I can basically get into an orthodontic residency, which I would be honest with you, the most interesting and the funnest thing I've ever did throughout my education. And I enjoy every day I work. I hate to put it that way, calling it work, because I'm not forced to doing anything. I'm doing what I like, and it's like playing video games when it comes to whether it's aligners or braces, and I'm enjoying myself. I'm listening to whatever I want to listen to while I'm working on the computer, and then I do interact with the patients, so we get to chat and forge friendships and relations and all that.
Awesome. Thank you.
Thank
And Jamie,
you.
what advice do you want to share?
I think I would, if you can put yourself in the shoes of an 8th grader, like Dr. DeSantis said, really, study hard, work hard, get involved. If you're, into sports, go into sports. If you're into the drama club, do that. Any of those things, just to get yourself to be a little bit more well-rounded. And just study and at the end of the day, you have to make yourself happy. It's not about anybody else. It's not about, it's what's going to make you happy. And, the dentistry field has certainly done that for, by the sounds of it, all of us. And so, and another thing, dentistry is going to be around for, the next 100, couple hundred years or whatever. So you'll always have a job. I mean, it's a, great field to get into. But at the end of the day, be happy and work hard. Awesome.
Thank you to everyone so much. This was such great advice. I think I want to go back now. I'm going to go figure it out. All right. So I just, again, thank you to all of our panelists for such great advice and really sparking students' interest in all the opportunities within dentistry. Now, we had a chance to see Dr. Mustafa working with a patient, getting to hear Jamie talking about what it's like working with children, Jim giving us all his exciting stories, and then being able to hear from Jennifer and Dr. Rufo about that clinic setting and kind of that pathway to help get in there. Really appreciate everyone making this such an exciting day. We are going to be having our next Spark panel on May 11th. So for our students and teachers, mark your calendar. We are going to look at careers in the IT field. And just to thank you again to everyone. I think Matt's got a slide he wants to share just to put up with some more information for folks who are interested in moving forward and taking all this great advice. So Matt, if you want to share that screen. Other than that, I hope everyone has a wonderful Tuesday. Thank you all so much.
Take care.
Thank you very much.
Thank you.
Thank you. Thank you, Matt. So yes, you can go right to Broom's website and check out some of their programs there. And then also, I think we sent some of our teachers an info sheet. There's also a program at Binghamton University. They do a pre-health program. And so folks who might want to get into dentistry, they have a partnership with with Buffalo, which I know we had someone from Buffalo on today as well too. So lots of great local opportunities to continue your study. So go check those out. Keep up with your math and your science and all those wonderful clubs and organizations to help you get well-rounded, everyone.